Hey guys, so this video we are going to try and finish out the rest of chapter 19. So it's going to be pretty good chunk of information, but we're going to get through it. So this section is autoimmune, excuse me guys, autoimmune disorders 19.2. So we have some specific ones, organ-specific ones, actually in our first group of autoimmune diseases. So one of them is celiac disease. And if you have gone grocery shopping in, I don't know, the last decade, you might notice that there are certain products that help with celiac disease. So celiac disease is caused by proteins where your body reacts to those proteins and it causes issues. So with celiac disease, it's going to react to a protein called gluten, and you're going to find that in grains like wheat, barley, rye, are grains that will have this gluten in it. And what it does is that your body is going to attack the gluten. It's going to become inflamed, and it is going to reduce the absorption in the intestines. It's going to reduce the microvilli. They're going to shrink down, and your absorption of your nutrients is not going to happen. You're going to lose weight. It's going to also be characterized by diarrhea. You're not getting that nutrients into your intestines like you need to. It's going to have some abdominal pain. So it's just not a great experience with celiac disease when you're reacting to these proteins to the gluten. So if you were going grocery shopping, you may have noticed, and sometimes on restaurant menus it will say it too, that something is gluten-free. So you are aware and you can shop purposely for the items that you need and have them and enjoy them without the gluten and without that miserable experience. So that is celiac disease. The next one is Graves' disease. So with Graves' disease, your body is going to produce this thyroid stimulating TSI, immunoglobulins. It's going to attack the thyroid stimulating hormone. So your pituitary is going to make thyroid stimulating hormone. Pituitary is going to release TSH. That's going to go out into the bloodstream, and then it's going to tell the thyroid to do its job. So when Graves' disease kicks in and it produces this TSI, it can possibly tell the thyroid, tell the pituitary to produce too much TSI, and so the thyroid is getting stimulated too much, or it can also block the thyroid hormone production altogether, so you're not getting anything there. So Graves' disease is a little tricky to diagnose. Signs, symptoms of Graves' disease is going to be irregular heartbeat, weight loss because your metabolism is going a mile a minute if you're hyperthyroid. It might also cause a goiter, which we're going to have a picture of in just a second, which is your swollen thyroid gland. Heat may get to you more so with Graves' disease than it ever did before. So signs of Graves' disease. Here is that goiter. I mean, look at this person's thyroid gland all swelled up as a goiter here on her neck. And then another thing that Graves' disease can cause are these protruding eyes, this exophthalma. And so this is another sign of Graves' disease. The next one on the list, Hashimoto's. So if Graves' disease is hyperthyroid, Hashimoto's is hypothyroid. So not enough thyroid hormone is being produced. So another name for another thing that Hashimoto's can cause, it can lead to other autoimmune issues. So if you've got Hashimoto's, you are more likely to be susceptible to type 1 diabetes, to rheumatoid arthritis, to Addison's and celiacs. Hashimoto's makes you more susceptible to those other guys. Other signs and symptoms for these Could be, it could also include a goiter. It can include muscle weakness, stiff joints. We said that you could be more susceptible to RA. So painful and stiff joints, it can lead to depression and memory loss. And you don't tolerate the cold well with Hashimoto's, where it was the heat with Graves' disease. Type 1 diabetes, juvenile diabetes, is where this autoimmune disease is attacking the pancreas, and specifically the islet of Langerhans that is going to house A cells and B cells. It's going to house the endocrine cells that are going to produce glucagon and insulin. So type 1 diabetes is going to attack the B cells inside that pancreas, inside the islet of Langerhans, and the B cells are in charge of producing insulin. So this is type 1 juvenile onset, type 1 diabetes, diabetes mellitus, which is different than diabetes insipidus, which has to do with ADH, which is a totally different hormone. Diabetes mellitus is all about the blood sugar and insulin and the B cells in the pancreas of in the islet of Langerhans. Last organ-specific one is going to be Addison's disease. Addison starts with an A and a D, and Addison's disease affects the adrenal gland, so that also starts with an A and D. So hopefully we can remember that Addison's disease affects the adrenal gland. And so it's going to attack the adrenal gland and the cortex of the adrenal gland. And the cortex is going to be in charge of glucocorticoids, mineral corticoids like aldosterone, glucocorticoids like cortisol, and your sex steroids, testosterone, estrogen. Those are all being attacked with Addison's and attacking the adrenal glands. With these hormones not being produced like they should be, you are susceptible to a whole plethora of things if you are possibly not having your glucocorticoids, your mineral corticoids, and your sex steroids produced like they need to. So signs and symptoms of Addison's disease are weakness, nausea, decreased appetite, weight loss, hyperpigmentation. So places are becoming much, much darker than they normally should. Hyperkalemia, too much potassium. Hyponatremia, not enough sodium. And remember when we learned about fluids in AP2 that sodium comes in, and if sodium comes in, if you have aldosterone that is increasing sodium, potassium has the opposite. So wherever sodium goes, potassium's going the opposite. So if you are hyperkalemia, where potassium's coming in, sodium's dropping, and that is because, again, you're missing your aldosterone, which is a mineral corticoid. What else we got? Hypertension. Oh, not hypertension, hypotension, which would make more sense. If your sodium levels are low, water follows sodium, so your blood volume is low, which leads to low blood pressure. You may have anemia, you may have lymphocytosis, where you're not producing enough white blood cells, fatigue. It may also lead to vomiting and abdominal pain, cramps, and that if you have low enough blood pressure, it can lead to shock. So another absolutely severe autoimmune disease specific to the adrenal gland with these. All right, what about other autoimmune things? Here's your sign for Addison's disease, where you can see the hyperpigmentation. But there's no change in coloration. Everything is extremely darker than it should be. Moving on to systemic. So these are not organ specific, like the pancreas or the adrenal glands. These are throughout the body, systemic. So the first one is MS, multiple sclerosis. This one is going to affect the brain and spinal cord. And what it does is it snaps off that insulation. It degrades the insulation. And when we learned in AP1 about the neural cells, we talked about how neural cells communicate, and they communicate better when they're insulated. So those myelin sheath coming from your oligodendrocytes, coming from your Schwann cells. Those things insulated your nerves and your neurons, and they got a better signal bouncing between the nodes of Ranvier in between those insulated myelin sheaths. MS attacks the myelin sheath, so it's affecting communication. Those neurons aren't being able to communicate like they need to. So this can lead to muscle weakness, difficulties with balancing and coordinating, numbness, pins and needles kind of feelings on the skin, and cognitive and memory problems with MS. Myasthenia gravis. I have another friend that's got this one. With myasthenia gravis, we learned that, okay, with your action potentials, right? We learned with muscles in AP1, the action potential is coming down the neuron, it's going to hit the bulb, we're going to have acetylcholine be released as this neurotransmitter that's going to go across the cleft, and it's going to hook up with the acetylcholine receptors on the muscle cell on the outside of it. So acetylcholine comes across the cleft, it attaches onto the receptors of the muscle cell, and then that is going to cause a reaction to cause those things to open. Sodium comes in, depot, potassium runs out, repol, and we're going to have this action potential that sweeps down the muscle. But if the acetylcholine receptors aren't there, you got myasthenia gravis, and you're not getting the signal from the neuron to the muscle. The neuromuscular junction is ruined if you don't have the acetylcholine receptors. So that is myasthenia gravis, where you are definitely going to have muscle weakness and potentially death if you are not getting the signal from your, what is the name of the nerve? Phrenic nerve that is innervating your diaphragm. Super important. So myasthenia gravis is attacking the acetylcholine receptors at the neuromuscular junction. So those can be super duper important. Psoriasis. Psoriasis is all over your skin, and it is itchy. Sometimes it is similar looking to eczema, which is what I've got going on. I got eczema. It's itchy, it's sore. Sometimes it could look red or scaly. We're going to see this in different places: elbows, knees, on your scalp, face, the palms of your hands, the soles of your feet. Excuse me. Sometimes this can also go into the joints for arthritis. So psoriatic arthritis, where your joints become inflamed. Rheumatoid arthritis is where your body is attacking bad joints. That's the only thing it's attacking with RA, is this chronic inflammatory disease that is attacking your joint areas and making them highly inflamed. We're going to have pictures of these in just a little bit with RA. It's very, very painful. And then the last one on the list is lupus, systemic lupus. And that is what, what's her person's name? Is it Molly? Is it Erica? Now I'm going to have to look and see. What was her name? Carrie. So Carrie has lupus. That's what they were testing her for, to see if she had lupus going on. So lupus is where you have antibodies, your body is attacking different things throughout your body. It can cause fatigue, it can cause a rash like we saw in Carrie, it can cause hair loss, it can cause the sun sensitivity that we also saw in Carrie's case. It can lead to other issues. It can lead to headaches, seizures, vision problems, tingling and numbness. My friend who's got lupus, she has poor circulation go into her extremities, to her hands. And so she gets numbness and tingling in her hand, and she can't play winter tennis when it's cold because of that. You can also get, if you're lupus, it may lead to arrhythmias of the heart, vomiting, nausea, shortness of breath, skin lesions. vasoconstriction in the fingers when they're cold, like I was telling you about. All sorts of issues and signs and symptoms throughout the body with lupus. So here is that picture of myasthenia gravis. I said that that was affecting the acetylcholine receptors. So here is our neuromuscular junction where we have our neuron. It is creating the acetylcholine because calcium came across and it triggered the accumulation and synthesis of acetylcholine. It's going to go across and those little vesicles are going to rupture. Acetylcholine goes across the cleft. It's going to hook up with receptors on the muscle cells. And here are all these little pretty green receptors here, these acetylcholine receptors. Myasthenia gravis are blocking those receptors. They are useless if you have myasthenia gravis. The acetylcholine is not getting across. It's not doing its job. It cannot hook up with the receptors. And so the muscle is weak. You are going to have paralysis. It can lead to muscle weakness and potentially paralysis of those muscles, which are very, very important, especially if we're talking about the diaphragm. We talk about psoriasis and how that can affect the skin, and it may also cause potential psoriatic arthritis. Here is rheumatoid arthritis, and this is specifically for the joints. You can see these. This, just looking at this x-ray, looks terrible. This looks severely painful. These joints look very, very swollen. It just, I can only imagine how bad these joints are on this patient and these fingers here. Lupus, you can see here is that rash. This rash, the wolf rash, across the face. We said that it could be a whole bunch of things, like lesions. It could be muscle aches. I didn't even list this one, inflammation of the pericardium. I definitely told y'all about poor circulation in fingers and toes. All sorts of things, vision issues, seizures, lots of negative things associated with lupus. Good news is it can be treated with medicines to combat this. Treatment lasts your whole life, but it is possible to treat lupus. There are drugs to help treat this. All the things that we have listed so far in a handy-dandy table, causes and signs and symptoms of these autoimmune diseases. Moving on. So now we're at the organ transplant section of the video, section 19.3. There are different types of grafts. So definitely know these. I always ask about these on the test. I ask about them in AP2 as well. So if you were taking a graft from yourself, auto means self. So say you had a part of your body, I don't know, maybe you're involved in an accident and the skin was removed in a car accident, or maybe it was a very severe burn and you lost skin in a certain part of your body, but the hospital was able to maintain you and they inserted a balloon underneath the skin in a different part of your body and swelled up the balloon and grew you some extra tissue. And so they were able to use that to graft on. Maybe you are undergoing a mastectomy for breast cancer and you need extra tissue. If you are getting the tissue from yourself, autograft from self to self, and you don't need to worry about rejection because it's your own cells with their own antigens, and your immune response is not going to attack it because it's you. It's you. It's okay. So autografts are fine. They are you. Other issues. If you are fortunate enough to have an identical twin, identical twins that we learned about in AP2 have the same DNA. That's the same DNA. So if you had an identical twin and you needed something and that identical twin could give it to you, that would be an isograft. Very little concern of rejection. Most of us don't have an identical twin out there. So in that case, if you needed a graft, a bit of tissue, an organ from somebody else who isn't you and who is not your identical twin, that's an allograft. So this is a relative or non-relative, and it is highly likely a possibility that rejection could happen because this is not your tissues. Your immune system can catch on to this and be like, what is up with this? This is not me. This is not ourselves, and start to attack it. So in the case of an allograft, you would need to be on immunosuppressants to hopefully prevent that from happening. If you needed a tissue from an animal, say you have a valve replacement in your heart because your valves are stenosed or something's going on with them and they're not working. So if you need a valve replacement and it's not coming from another person, it might come from an animal. Maybe you have a porcine valve or a bovine valve. If it's coming from an animal, it is a xenograft. And just like tissue that was not yours in an allograft, this is most definitely not your tissue. And rejection is another possibility in this case, and you would need to take immunosuppressants. Graft versus host disease. With graft versus host disease, oftentimes you may need to get tissue from somebody, and sometimes that tissue's very right. Do you need an organ transplant? Is what's going on? Is it skin? What do you need? If it is a bone marrow transplant, bone marrow we know is the source of blood cells. All the blood cells are coming from bone marrow. And so that includes your immune system cells, right? Your red blood cells, your white blood cells, your platelets, all that stuff is starting and beginning. And some of that even matures in the bone marrow. Your B cells are going to be in the bone marrow. So if you got a graft of bone marrow from somebody else, those are going to have your white blood cells. Those are going to have your immune system of somebody else's inside you. And those graft cells may start to attack the host cells. They may recognize the host cells as not self and start to attack them. So that is graft versus host disease. If you had a bone marrow transplant with your blood stem cells, something like that, it may attack graft. The graft may attack the host in this instance. Transplants in the future. The textbook mentions transplants in the future and that we are hoping, excuse me, as technology advances, as medicine advances, we are learning so much more about stem cells, and hopefully in the future we will be able to create tissues that we can seed with your own stem cells, and your body will recognize it as self, and you won't have to worry about rejection. They are also looking into genetically modifying organisms to grow tissues, to grow organs that are not going to initiate an immune response from us, from these genetically modified, donor pigs, is a possibility. They are already used a CRISPR to try and genetically modify embryos to implant in a pig to have a chimera of a human pig chimera that could potentially see if it could grow organs. So there's all sorts of, and that's from like 5 years ago. There's all sorts of stuff happening all the time as far as transplants and the need for human organs, because the UNOS list for donors, a lot of people do not receive the tissue, the organ that they need in time for them. So this is a very big, important issue. All right, Carrie is positive for lupus with her test. We talked about the nuclear test and the Schmitz test. And so she does have lupus. It cannot be cured, but we said there are therapies to help reduce and manage her symptoms. And hopefully those symptoms are going to get under control. So let's check and see. They're going to give her some hydroxychloroquine. Man, we've heard about that stuff in the news in relation to COVID. But hydroxychloroquine is a form of treatment, a drug that can help treat lupus's signs and symptoms. Reducing exposure to sunlight. Using hydroxychloroquine and other anti-inflammatory drugs. So let's see what's going on with her. Over the next 6 months, Carrie is using these drugs. She's following her treatment plan to stay out of the sun. And her symptoms do not return. She might have flare-ups in the future. Yeah, of course, that will always be a possibility for her. And she will need to continue her treatment for the rest of her life. But we figured out what's going on with Carrie, and we've given her some drugs, and we've given her a treatment plan, and she is getting better. So that is good. All right, second to last section, immunodeficiencies. There are two types of immunodeficiencies. There is primary. With primary immunodeficiency, it's a genetic issue. You are born without these defenses, and they could be innate defenses, they could be adaptive immune defense, but you do not have the full complement of innate and adaptive immune system like you should. And I'm not going to go into the very different types of primary immunodeficiencies, but I want you to know that those guys are inherited with primary immunodeficiencies. There are secondary immunodeficiencies too. Let's get as an example of our primary. Secondary immunodeficiencies. These are going to be a result of it's secondary to something else. So maybe you have type 1 diabetes, and that could cause a secondary immunodeficiency. Type 1 diabetes, malnutrition is the biggest cause of this. Simply not getting the nutrients that you need can cause a secondary immunodeficiency where you do not have the proper functioning B and T cells that you need. So malnutrition is a big cause. Other causes are infections. If you're on immunosuppressive therapies, if you're on chemotherapy, like my brother-in-law is doing chemotherapy, if you have radiotherapy, both of these can cause secondary immunodeficiency where your B's and T cells are not doing what they should. Viral infections, the prime example is HIV. That takes out what kind of cell? Anybody remember what kind of cell HIV takes out? Helper Ts. Helper Ts. Helper Ts are super important because they're going to trigger your cytotoxic T cells, but they're also going to trigger your B cells. So without your helper Ts, your Bs and your T cells don't know what to do without the helper Ts. So HIV is going to attack those helper Ts, and when the helper Ts get low enough, then you are then considered into AIDS. This is a picture of the bubble boy. He has primary immunodeficiency. He was born with SCID. Severe combined immunodeficiency. Last section of chapter 19 is cancer. So cancer does send out signals, and your cell-mediated, those T cells, can respond to those bad boys. So if you have a cancerous tumor, sometimes those T cells do their job. They recognize that stuff's not right, that those cells are abnormal, and that we need to do something about them, and they can target those guys and attack the cancerous cells. Unfortunately, cancer is a tricky little booger, and it has found out ways to fool our immune system. Sometimes it will switch up its antigens on the outside so we don't recognize it. Other times it may hitch a ride inside of the immune system cells themselves. Cancer is super tricky. It's got lots of different ways for it to fool our immune system, and it is something that we are constantly battling and trying to figure out new ways to combat and prevent. So one of the ways that we might prevent is a cancer vaccine, a preventative. Relatively new-ish in the last 10 years is the HPV vaccine. What is HPV preventing? Anybody know? What's the HP stand for? Human papillomavirus. So if we can prevent the human papillomavirus from attaching, it can hopefully prevent cervical cancer in women. And so HPV vaccines are given to many, many people. Possibly some of y'all have had your HPV vaccine. I know my kids have gotten it, at least one. I know my oldest has. I don't think my middle and my youngest has. But they are getting them. Male, female, it doesn't matter, because all of us can be immune to those strains if you get the vaccine, and then hopefully prevent that and hopefully prevent it from passing to a partner. So HPV is a type of cancer preventative vaccine, but there are also cancer treatment vaccines. One of them is called Prevenge, and it is for prostate cancer treatment, to attack that. There's another one for melanoma treatment. I have a friend of mine right now who's got internal melanoma, and she is battling it out right now. She is fighting for it. So cancer vaccines could be preventative, or they could be therapeutic to treat you after you are diagnosed with it. So this is the last of chapter 19. Please let me know if you have any questions about it. Have a great rest of your day.